Hospice had a very personal connection with me, but within the last couple of years I've tapped into hospice care at Memorial Hermann for both my parents, who died within about 30 days of each other of terminal conditions, and for my wife, which died from a terminal brain tumor. And I can't speak from a personal point of view how helpful that was, because that is such a difficult and unknown journey for most of us, if not all of us. And to try to accomplish that without any prior experience or understanding is a very difficult task at hand. And so from my own personal experience, I have to say, in helping my loved ones transition that important time in their life, was incredibly helpful. As a physician, certainly I see the value of having hospice involved. The medical professionals that are there are uniquely trained to help people deal with that time in their life, and combine that with the personal aspect that the patient and the family needs, you have a very, very powerful combination in terms of helping to deliver the best care possible. And Memorial Hermann has terrific professionals in that regard. From a community standpoint, I take a run at that from my role as a legislator, and we look at truly what are the things at the end of life that we need to be focused on. And we know that we can spend a lot of time and a lot of money, helping people, quote unquote, stay alive. But what we also know in terms of honor and respect at the end of life, and cost effectiveness, frankly, one of the best things that we can do is tap into hospice, which has evolved into a very, very clearly defined beneficial medical specialty, frankly. Well, they provided a lot of professional support from a medical point of view, certainly. They provide uniquely some of the medications that you need to try to manage the person's passing. They also provide you with the spiritual resources, if you need those. A lot of people don't think of that side of it, but this is a very spiritual journey that people go through in that last phase of their life. And that having that available to them through the pastoral services, or at least access to those services, is a tremendous comfort. As a physician, you understand that they're going to get whatever the best of the medical treatment is at that point. And that's a different kind of medical treatment, clearly, than somebody would get if you're obviously just trying to extend their life for other purposes and things of that nature. But what we know as a physician, that a lot of these medications have been tested. They're known to have a very beneficial effect on the end of life. And as somebody who wants that from a medical standpoint for either your patients or for your loved ones, that's a very comforting thing. We know that you're not experimenting with things. We know that, in fact, you're getting tried and true ways of treating people and helping them get through this difficult time. Texas is actually very progressive in terms of its advanced directive law, and I think there is continuing efforts to always look at the advanced directives and what can we do to really help people, get comfortable with what is an end of life. We all know that point in time will come. We don't know how it will come, but what we do know is when that period approaches us, we want to handle it in a very dignified, respectful, and honorable way. And we always need to be looking at the law with regard to this in that vein. It always needs to be about honor, respect, and comfort at the end of life. It's not about trying to extend life just for the sake of extending life, but in fact recognizing that this is a time that will come in all of our lives. And if we have the option to approach it with honor and with respect and with grace, if you will, then that's what the laws always need to be about.